Good morning. As we have people continue to join, we will get started. Welcome to our next installment of their Telehealth at the Crossroads Summer Webinar Series. As many of you know, we've had an annual conference for a number of years, but with social distancing and a pandemic in the works, we have converted to this webinar series. We started, it's every Thursday in July. These webinars will be recorded and will be available on the TxLA website. Next slide. Just a little bit about the TxLA Telehealth Resource Center. We are federally funded by HRSA and funded through Texas Tech University Health Sciences Center, the Division of Rural and Community Health. We also partner, we serve all of Texas and Louisiana. We partner with the Louisiana Department of Health, more specifically the Office of Rural Health in Louisiana that comes under the heading of Well Ahead Louisiana. Next slide. There are 12 regional telehealth resource centers and 2 nationals. They serve every state and some territories in the Pacific Basin. As you see, we cover Texas and Louisiana. We have 2 national centers, the Center for Connected Health Policy that keeps track of the policy federally and from state to state, and the Telehealth Technology Assessment Center. And we are very pleased to have the Technology Telehealth Assessment Center with us today to talk about technology trends during these challenging times. Next slide. So while we switch over, we have Doris Barta, who is Director of TTAC, the Telehealth Technology Assessment Center, and Jordan Berg, who's a Technology Specialist with TTAC. And so I will turn the presentation over to them, and thank you for being with us today.
Thank you, Becky. We are really looking forward to talking with you all today about the technology trends during challenging times that we've experienced in the last 3 or 4 months. So Jordan Berg and I are the 2 people who will be presenting with you today. Go ahead, Jordan. Next slide. So Becky introduced TTAC to you. So let me just talk a little bit more about us. As is TxLA, TTAC is also funded through the Office for Advancement of Telehealth. And we provide technical assessment services to the 12 regional telehealth resource centers and anyone else actually who contacts us and wants to learn about technology trends with telehealth. But primarily our role is to serve your resource center when they have questions about technology so that they can then serve you. So there are 3 of us that are associated with TTAC. Garrett Spargo is our PI, and he is looking in Jordan's eye there. Jordan is our technology specialist, as Becky introduced. And between the 3 of us, we have over 50 years experience in working in the telehealth field. So one of the things that we do is we do technology showcases. And usually we do those showcases at regional conferences. But as Becky shared with you, right now we're not traveling and we're not doing regional conferences. So we have virtualized our technology showcase, and we provide that for regional virtual conferences. But that's one of the things that TTAC does, is we look at medical peripheral equipment. We are vendor neutral, and so we provide information just based on our technology assessments of that technology. So as Becky stated, we are also a member of the National Consortium of Telehealth Resource Centers, and the NCTRC has a website at www.telehealthresourcecenter.org. And I would advise you to go ahead and take a look at their website, because we have resources that we put on that website that all of the 12 regional and the 2 national TRCs have developed, and those are all resources that are free to you if you're looking to either create a telemedicine program or expand an existing program. So Becky showed you the map, and this is actually a picture of the map that is on the NCTRC website. The cool thing about that is that it's an interactive map. So if you are looking for contact information for anywhere throughout the United States or one of the 2 national TRCs, all you have to do is click on their icon, and that'll take you directly to information about who that contact person is and how to get a hold of them. And it'll drive you to their website. So today, what we want to talk about is the state of telemedicine technology, especially in the COVID-19 crisis. We will be talking to you about trends in web-based video platforms that are designed for video technology. This includes security and privacy issues telehealth providers are having to navigate. We will be talking about the state of broadband connectivity in the US, and most specifically for our rural patient sites. We will be providing you with some general thoughts from a recent assessment that we performed on common video platforms. We will discuss technology and the user considerations for both the providers and the patients. And finally, we will leave you with some practical thoughts as you continue to make technology decisions related to the COVID-19 or any other pandemic crisis that may occur. So the first thing we want to talk with you about is telemedicine platforms. The telemedicine world has experienced COVID-19 as both a disrupting and reinforcing force in the telemedicine market. We're sure that you're not surprised that the amount of interest in telehealth has increased significantly since this crisis began. Organizations are wanting to get new telemedicine functionality set up as quickly as possible, and there is an increase in interest in reaching patients in their home. I was visiting with a colleague of mine the other day, and he told me that 100% of their pediatric physicians are using telehealth, and 99% of their adult physicians are using telehealth. So they went from 1,200 encounters a month to over 44,000 encounters a month. So this is just one signal of the significant increase in the use of telehealth. So specifically for video-based telehealth, there are a few key features that should be considered in your selection process and key concerns that need to be addressed or at least understood. So with the key features, COVID-19 has moved many programs towards a web-based video platform because they can be set up quickly. While this is not a new trend, we have been tracking this for a while, and the accelerated pace for this movement has been exponential. The biggest change that we are seeing is the rapid use of the patient home as a care location. This means that we are now using the patient's equipment, such as their tablets, smartphones, their consumer-grade Wi-Fi, and mobile networks. It also means using platforms that can connect with patients using simple connection methods like email, text message, or through a patient portal. To that end, we are seeing more patients having to download a desktop application or creating a mobile account. Finally, many providers are wrestling with whether to pursue a general video platform that provides telehealth applications, as well as web-based conferencing, or maybe they want to invest in a more dedicated telemedicine solution that includes patient management, scheduling, and other clinical functionality. So what are some of the key concerns? COVID-19 has been a stress test to the telemedicine capability of organizations, service providers, and vendors. It has made us focus on several key features that are necessary for any rapidly deployed service. So, deployability, how quickly can a new service or expanded service be deployed into a clinical environment? If you purchase a new platform or device, how soon will you be able to use it with patients? Scalability, How rapidly can you move from seeing a dozen patients a week to maybe over 100 patients a week? Does your network support this spike in traffic? Do you have enough software licenses to cover the spike in the demand? Reliability. If you get a new service or device, how reliable will it be for actual patient care over time? And ease of use. In addition to all of this, there are so many more providers and patients using this technology, some of who have never considered using telemedicine previously. Having products that are simple to use and easy to train on is vital in delivering the care that you need to provide to the patients. And in the middle of all of that, we need to be consistently thinking about security and privacy, and that's why we put it in the middle of that slide. So we're going to talk about security and privacy specifically because it's been a hot button topic for telehealth and video conferencing in general. We are seeing two forces affecting security and privacy during the COVID-19 crisis. One is a relaxation of some of the HIPAA compliance and other regulations around platforms that can be used to deliver patient care. This has allowed clinicians and patients to connect and be reimbursed using non-traditional technologies. The Office for Civil Rights has published a notice about the types of technologies that are and are not appropriate for patient care. They specifically mention FaceTime, Facebook Messenger video chat, Google Hangouts, Zoom, and Skype as potential platforms, although they are sure to state that this is not the full list. But they also mention some platforms that should not be used, like Facebook Live, Twitch, and TikTok. So generally speaking, if the platform is designed primarily for broadcast or one-to-many communications, it's not a video telemedicine platform under the discretionary notice. Overall, this relaxation of privacy rules is sure to be a temporary measure, and once the pandemic is over, we will need to adjust our care to more secure platforms. We are also seeing some concerns raised over high-volume video service providers in relation to security and privacy. Some of these issues are related to users not understanding the security tools that are built into the product they're using, or perhaps an organization not establishing effective procedures and controls for video conferencing. Other issues point to a deeper problem in the way some of these video providers handle their data. Now, regardless, we are seeing growing pains as organizations, vendors, and consumers deal with the new ways of seeking and delivering care. Now, Jordan is going to talk about a recent assessment we did of common video platforms and how they performed under low bandwidth conditions. Jordan?
Thank you, Doris. So like Doris had mentioned, we recently performed a kind of a stress test of several different video platforms that are being commonly used to deliver patient care. So the diagram that you see on this slide, it kind of shows what our setup was for the test. We had a 100 megabit per second network connection that we connected to via a network emulator. And what this allowed us to do is it allowed us to simulate a variety of different network problems and limitations that we could see just how these different video platforms performed. The general setup is that we had a standard recording that we wanted to play through the video conferencing solution just so that we would have a standard experience. So we used a 60-second clip of some Harvard sentences, which are just kind of nonsense phrases that are kind of mashed together, but that they provide good sibilants and different vowels and consonant sounds to give us a good understanding of what actual speech would sound like through the platform. So we had a 60-second recording clip that we use. We would play that through a patient-side video endpoint, run that connection through our network emulator where we would introduce low bandwidth, we would introduce packet loss, we would simulate jitter, and then we would receive that video endpoint on the other side, at our provider side. And from there, we would actually record the results that we were getting on that provider side. The reason that we used two separate laptops for both playing the video and recording the video is we wanted to move as much of the heavy lifting, the recording and the playing of these videos, off of the devices that were actually doing the transmission of the video. So that the platforms that were actually sending the video and receiving the video, that's pretty much all they were doing, is just sending and receiving, so that we wouldn't have a hardware limitation kind of impacting our network. The things that we were looking for as we did this test were connectivity. So with connectivity, how easy was it for a particular solution to connect, to stay connected, and to kind of maintain its quality of connection once it was connected. We also looked at video quality within the various platforms, including frame rate, resolution, color, and overall clarity. We looked at audio quality, primarily to discern if voices were easily heard, if they were understood, if there was a lot of distortion or things that added. The bottom line being, can I understand what's being spoken to me kind of across this session? And then we looked at kind of at a high level of general usability and overall user experience. We want to get into some of the general trends that we saw during our assessment here. So we recorded over 120 test videos across 8 common platforms. We looked at platforms that used video conferencing over browser, mobile, and desktop and app-based connections. We tested at a variety of different speeds. The 100 megabit per second, we mainly used this speed to determine kind of how thirsty these different platforms were. If we did not kind of constrain them in terms of what the bandwidth was that we were allowing them to use, how much bandwidth would they use to connect to these different, to connect these calls. The 1 megabit per second connection is a good way to simulate a connection that's okay but not great. This is a common reduced bandwidth that we see in a lot of different places. 512 kilobits per second is a useful representation of the type of connectivity we see in many rural areas. 384 kilobits per second is a common connectivity level for communities that may be based on satellite or other pretty limited connections. And 256 kilobits per second was really the bandwidth stress test. It was the floor of the testing that we did. And a lot of platforms really had trouble performing at this 256 kilobits per second level. Not only did we change the speed with which the different platforms connected, we also ran them through different profiles of connectivity. The first one was obviously a clean profile. We did not introduce any delay or packet loss, and the only variable that we changed was the bandwidth. So we did recordings with those. We did recordings simulating a clean satellite, which was similar to what we did above in terms of speeds, but we also introduced about 600 milliseconds of static delay. And what this does is it helps simulate how long it takes a signal to kind of go into space, hit a satellite, and then come back, to really simulate what that satellite experience is like for users. We also simulated what a connection might look like over satellite with congestion or other issues, and we call that our dirty satellite connection. So it was the same as what we had above, that 600 milliseconds delay, but over and on top of that, we added a variable 100 millisecond delay to simulate jitter, which is when packets arrive out of order or not in the way that we expect them. And we also introduced about a 10% packet loss. Just to see what, this kind of helps simulate what a congested network looks like when you have packets that are being lost kind of in transit between point A and point B. The last profile that we looked at was our horrible network. This went by a couple different nicknames as we did our testing. We called it the dirty network. We called it the horrible network. But this was kind of the worst network that we could kind of come up with, that we had any kind of reasonable expectation that these platforms would work in. So we added had a 200 millisecond variable delay. So the delay would vary anywhere from 0 milliseconds up to 200 milliseconds on any packet that it sent. We had 20% of packet loss, and then again, we ran that through the various different bandwidths that we looked at. So we're going to look at some of the common themes that came out from our testing, and just kind of talk to you a little bit about how these platforms just did in general as we kind of ran them through this little torture test. So what we found, and what was kind of interesting to us, was a lot of times the biggest challenge we had working with these different platforms was in getting them and keeping them connected. So most platforms would, if we were unrestricted, they would take about 3 megabits per second down and about 2 megabits per second up. That's the amount of bandwidth that they wanted to use. But even with an unlimited network, there could be some significant delays in how long it took to connect and to stay connected within these platforms. So even on a clean connection with no packet loss, no delay, it could take 30 seconds or more to connect to the video connection on both ends. The ability to launch and stay connected becomes even more challenging once we start introducing reduced speeds, packet loss, and delay. So the good news is that once we are connected, most of the platforms could handle a little bit of network instability and stay connected and still keep the call going, even when we varied the speeds and we introduced other networking artifacts into the call. One of the other things that we want to point out is how do the different platforms deal with low bandwidth connectivity? And they all deal with it in a little bit of a different way. One common theme between the different platforms is most platforms will prioritize the audio quality over the video quality. And what we mean by that is when a platform is experiencing network degradation, the first thing that they'll do is they'll reduce their video quality and they'll maintain the quality of their audio for as long as they possibly can. And then when they have to begin reducing the audio quality, they'll reduce the video quality more in order for you to be able to still be able to hear even though you can't see very well. So this means while an image quality might be very, very poor at low bandwidths, most of the time platforms are still able to support understandable audio even at really low bandwidths. Video quality is reduced in different ways on different platforms. So some platforms will drop the frame rate, leaving the image resolution relatively high, but making the video seem jerky or seem like it stutters and just slower. Other platforms would reduce the resolution of the video but keep the frame rate high. So this provides a smoother but a more pixelated and more blurry video. And how they do the reduced resolution varies between different platforms as well. We saw some platforms would just reduce the overall size of the image that you see on the screen. So instead of it taking the full screen, it would be centered in the center of the screen, but still look fairly crisp because it was just a smaller image. Others would introduce more pixelization or would just smooth out edges. So what you will see is you'll see a generally more blurry image, but it can either look a little bit more digital or just a little bit more fuzzy, depending on the different types of different ways that they're reducing that resolution. Looking at web-based video platforms. So these are platforms that don't require any sort of client. They work entirely through a browser. So web-based video running through browsers are more likely to reduce video quality while maintaining the audio quality. So we talked about how all platforms did this. Web-based video platforms would do this, we use the term aggressively, meaning that if you took a desktop client solution and you took a web-based solution, a lot of times the audio that you would get from the web-based solution would be better at the cost of the video. So web-based video solutions would more harshly prioritize the audio over the video versus their desktop counterparts. Additionally, what we saw was that web-based video platforms tended to have a lot of connectivity overhead. And what we mean by that is logging in, finding your call, connecting to your call. All of these were internet interactions that had to have. And on very low bandwidth or bandwidth that were very dirty, all of this traffic was harder to connect. So for solely web-based RTC, especially when we started introducing delay or packet loss, it became more and more challenging to connect and stay connected at these lower bandwidths. Once we were actually able to connect the video and we were able to see both participants on the call, most of the time the call would stay connected, but for the WebRTC, it would just became harder to connect at these very low bandwidths. Clientless solutions, so solutions that don't require any sort of download or can just be open via a link, performed much or had much more video and audio degradations at lower speeds than any of the other platforms that we saw. So there was a big challenge for these simple clientless solutions that you can kind of just click on and go. The less software that you have on your device or not having a dedicated app made the connections a little bit more challenging. And finally, we want to talk a little bit about mobile. This is a common way that we're connecting to a lot of our patients these days. Most solutions in the mobile space had very poor performance below 512 kilobits per second. And that was not kind of what we saw on a lot of the desktop solutions. So we could have a fairly decent connection at 512 kilobits per second on a desktop application, but on a mobile application, the audio and video was a lot more corrupted. Mobile solutions are much more likely to be impacted by low bandwidth and packet loss than the desktop solutions. So in general terms, what was most likely to impact the audio and video quality of these platforms? And the answer is packet loss. So what we saw is even on very low bandwidths, a lot of the platforms could get and stay connected, and we could have a exchange between the two endpoints where participants could be seen and heard. But as soon as we started adding in packet loss, the video and audio quality dropped dramatically, even at relatively low levels of packet loss, of 5 or 10%. So what this kind of tells us, and what we can kind of take away from this is, not only is overall speed important when we're connecting our different video platforms, another concern that we really need to think of is the quality of our connectivity. How congested are they? What sorts of delay can we experience on these different platforms? Especially for satellite connectivity. If we have a significant delay or jitter because of a satellite connection, that can impact the call even more than the overall speed, potentially. And that brings us into our next topic, which is kind of what is the state of broadband within the United States? So the internet infrastructure in the US has actually held up surprisingly well in the face of COVID-19. So we've had reports from the FCC and other sources that indicate that we've had about a 30% increase in network traffic over pre-COVID network traffic. The increased demand is not only just related to healthcare, but also when schools were in session, we had increased connectivity load due to education. We can expect more of that in the fall. We have a lot of our workforce working from home, and then social distancing activities are increasing the amount of digital delivery we're using for a lot of different applications. There has been reports of some regional slower access in high consumption areas, but in general, US broadband infrastructure seems to be adapting and expanding well to the crisis. But one of the primary concerns for US connectivity is there's a real disparity of broadband access between rural and urban areas. So there was a 2018 FCC broadband report that stated that 24 million Americans were still lacking access to broadband speed internet. And of those 24 million Americans, 80% of those were categorized as either rural or tribal. So COVID crisis is really teaching us that how important it is to be able to have that digital connectivity, how important that is to healthcare and just to the person's general well-being. The disparity of access between rural, tribal, and urban areas is going to be one of the challenges that really needs to be addressed and that we should be aware of as we're looking at telemedicine solutions in our areas. Can the infrastructure that we have really support the care that we're wanting to deliver? Next, we want to talk about some of the technologies that we're seeing used and some of the things that providers can do to really improve their quality. So TTAC has been tracking trends in video conferencing equipment for years now. And what we're seeing is as more organizations move towards web or desktop-based video solutions, we're beginning to see more interest in USB-based peripherals for just improving the experience that we have. So we all know that in general, we can take a laptop and it's going to have a built-in microphone, it's going to have a built-in camera, we can make the video connection go. But as we begin to look at, well, where do we get the most bang for the buck in terms of improving our video experience? So on the provider side, one of the things that we really recommend in terms of getting the most out of your experience is we can improve our audio experience in a fairly low cost way by introducing kind of a standalone audio solution using USB technology. Having a dedicated audio solution for the provider, like a USB speakerphone or a headset, can vastly improve the audio experience for both the patient and the provider. Audio solutions can create a better recreation of the human voice and allow a little bit more transparency to the technology. So that we can have better interactions with our patients. So the low-cost solutions can enhance the overall experience. The other thing that we can do is we still have a lot of potential to improve our experience by getting a standalone USB webcam to kind of enhance our video as well. Even a moderately priced webcam still tends to perform much better in terms of field of view, color accuracy, and clarity than the built-in cameras that we have in most of our laptop solutions. That said, we have seen big strides within laptop developers to make these cameras better and better and better. And then on mobile devices, the cameras that are built into those tend to produce a really good image. But if we're using laptops to do patient care, it really is still worthwhile to look at USB solutions for a dedicated video conferencing platform. Another trend that TTAC has been following in, actually, let me take a step back. One of the really important things that we look at as we're looking at our video solutions is making sure whatever solutions we get are very simple for our providers to use. If you want, especially if you want to scale with any kind of rapidity or and you want to make sure that you're getting access to your patients as quickly as you can, you're going to need an intuitive, easy to use solutions that can be quickly set up and that really don't get in the way of patient care. So if possible, it is really wise to have clinicians involved in the technology selection process, have them part of your testing plan, because they're going to have a different viewpoint of what makes a good telemedicine peripheral, what makes a good telemedicine solution than you might get from your administrative or your IT professionals. And having their viewpoint is very helpful as you kind of move into picking a solution. Next, we want to talk about another trend that we're seeing on the market, and that is we've been looking at, over the last probably 2 or 3 years, the rise of all-in-one USB solutions for audio, video, in a single USB plug-and-play peripheral. There's a common marketing term that's used for this type of technology, and you'll hear them referred to a lot as huddle space peripherals. These devices are designed for small or medium-sized conference rooms, but they can be utilized for clinic or group sessions as a video conferencing platform. In general, this sort of technology will have an integrated microphone and an integrated speaker solution. They may have integrated pan-tilt zoom functionality, and we're seeing a rise of a lot of these solutions that have smart speaker selection. So they'll have a large image, and within that image, they'll be able to find the active speaker and actually frame the image that's being transmitted to the other side based on who's speaking in the room at any given time. So we have 3 different kind of devices here that kind of demonstrate some of this all-in-one audio video combined solution. The Poly Studio, Logitech Meetup, and the Meeting Room Owl are kind of different devices that provide the solution for us. And we want to kind of give you a sample of what the images that we get from these when we're actually transmitting them over a video platform. So as you can see here, these offer a wider field of view than you get from a lot of your USB-based webcams, kind of your standard C920 type webcams that are just very, very common. With the Meetup and the Studio, we're able to, with the Meetup, you have a physical pan-tilt zoom. There's actually a little motorized camera that you're actually able to pan within a room as well. So you get about a 70-degree field of view from the camera itself, but once you figure in the pan-tilt zoom, you're able to see almost 180 degrees. The Studio has a very large digital sensor, and then within that digital image, it's actually able to pan and zoom so that you can get a digital version of that pan-tilt zoom technology. The Owl's a little bit different in that it actually has a 360-degree camera, and you can see that by represented in that band up at the top of the screen there. And then what it does is it actually goes in and it digitally slices that image based on who's speaking in the room. So these are the sorts of technologies that we're seeing implemented in a lot of telemedicine programs and platforms that provide kind of higher grade, almost boardroom level video conferencing technology in a USB simple to use format. Next, Doris is going to discuss some of the ways and strategies that we can use to engage patients in a telemedicine encounter in our new COVID-19 environments.
Thanks, Jordan. So, as we've been talking, and as many of you have probably been experiencing, we're working with patients in their home environment now. And so we need to be a lot more flexible, and we need to really be understanding with them as we engage them over this new technology. This is something that most of them have not experienced before. So as we stated earlier, we will be using their existing technology in their home. So the vast majority of these cases means that we're going to be using their phones, their tablets, or their laptops. A friend of mine has done an assessment of the type of technology that they're using in the home, and over 90% of the patients that they've been providing services to are using their cell phone. So that's what we're going to see going forward. This means that we're either using their consumer-grade Wi-Fi or their cellular connection in many cases. So being able to guide our patients through how to get the most out of their technology is really important. It's worth stating here that having a plan and integrating that plan in a calm and thoughtful process is really important to reducing the stress of connecting. So this can be as simple as having a backup connection plan. For example, if the video goes down, I'm going to call you back. What is the right phone number for me to give you a call? That shows the patient and the provider really that you have a connection plan, and that makes a lot of difference in easing the anxiety of both the patient and the provider. It may also be important to reach out and test with the patient before you have the care experience so that we make sure that everything is working. So assuring our patients and providers that this is a normal part of our care plan can really go a long way in making sure that they have a positive telehealth experience. And that leads to our final patient thoughts. We need to develop a rapport with our patients and create a comfortable environment. We need to visit a little bit with our patients when we're doing a telehealth encounter. When we walk into our provider's office, for example, we sit down with our provider. We have a little bit of a conversation with them before we get into our clinical encounter. We need to do the same thing when we're using telehealth. Telemedicine works best when we can make the technology as invisible as possible. So now Jordan and I would like to leave you with two sets of key thoughts. The first are some general concepts we address in almost every presentation we do about telehealth technology. The second set of key thoughts are specific to the use of telemedicine in the midst of the COVID-19 pandemic. As Jordan shared with you earlier, it's important that the technology chosen should support the need and the workflow of the organization, and it must be supported by its users. Technology for technology's sake either ends up in the desk drawer drawing dust, or it becomes a lab coat hanger. Spending hands-on time with the piece of technology is vital before you make purchase decisions. Trying before you buy can be the difference between a successful and a failed program. And finally, as Jordan shared earlier, make sure you get your whole team involved in the choosing of the technology. Your clinical staff, your administration, and your IT department will all have different ideas about what makes a good telemedicine system. Make sure you collect the input from everyone and make sure that the details are documented and communicated. This is vital in developing a successful telemedicine program. And our final thoughts for you today are, although the previous thoughts are just as much true during this COVID-19 pandemic, we also wanted to add some specific thoughts about how the use of telemedicine technology has changed over the past few months. So COVID-19 has required a flexible but robust response. Telemedicine is a great tool for reaching existing patients or patients that we can no longer see in person, or even patients who are affected by the virus. This means we may be seeing patients in their home on their mobile devices, using their consumer-grade internet and mobile connections. So it's important that we remain flexible. And it's important that we text connectivity when we can, and that we have backup options when things don't work. Reassuring the patient and the provider that this flexibility is a part of the plan can really help mitigate frustration. As we expand delivery of care using telemedicine, we are also expanding our risk. Unfortunately, the COVID-19 crisis has highlighted the challenges of getting new technologies to new users and new patients. It can be challenging to determine how potential partners are defining and managing risk on their end. It is important that even in a crisis, we make every effort to train and educate our users on the technologies we are using, the controls we have in place, and the importance of their role in the security and privacy. It's also important to work with our technology partners to make sure that we have an understanding and insight into the risks. To use an analogy, telemedicine technology is a power tool, and we are handing this tool to our patients and our providers. If we can ensure they understand how to safely operate this tool, we can build useful care models. If we don't, we can cause a lot more harm than good. We also need to have frank conversations with our technology partners to make sure that we have a common understanding of the shared risk. Security and privacy is not a checkbox, it's a daily discipline. And a last thought is, unfortunately, we're in a moment of time for just-in-time solutions. But it's also important that as we select technology and plan our care models, we are thinking about how these solutions will work for us a year from now or even 5 years from now. As providers, patients, and health systems rely on telemedicine to solve current problems, we can expect them to rely on telemedicine in the future. What we build today is what we will be using tomorrow. So Jordan and I would like to invite you to contact us at TTAC. This is how you can contact us through our website, www.telehealthtechnology.org. We have a request icon there. You can just click on that. You can type in your name, your contact information, and what your question is, and we can answer your question and provide feedback to you. So, or you can just give us a call and at our phone number there. This is our contact information. And we just would like to say thank you for giving us the opportunity to connect with you and provide some insights to you as what we consider telemedicine technology trends. And now at this point, we'll open it up for questions. And Becky, do you have any additional thoughts that you would like to share?
Thank you so much. We really appreciate that you have this level of expertise in an area that most of us don't. I often refer to, I would encourage you to go to their website. There are toolkits on how to select a platform, and I frequently refer to those for those that are new to telehealth. And they also have user reviews of many pieces of equipment in the technology. We do have one question here. Is there a published source yet citing the 90% mobile phone use for telemedicine? That's amazing.
So a colleague of mine has a telebehavioral health grant, and part of their assessment that they have done with their patients is how are you accessing telehealth? And the responses of their patients in that grant was 90%. And he just shared that information with me one day when we were on a conference call, a Zoom call. And I just thought that that was fascinating. And so I shared that with you. It'll be interesting to see, and I'll bet over the course of time, we're going to get more information about the direct-to-consumer healthcare and what kind of technology people are using. So definitely, if we get anything written, we will put that on our websites so that you can access it.
And another question from Dr. Phillips. Would you address the peripheral devices that can be connected to smartphones to provide clinical information, such as EKGs, et cetera?
Yeah, I can handle that one, or we can talk about that. So what we're seeing is there is a rise in the different types of peripherals that can be connected to a smartphone. One of the challenges that we have is that for most of these devices, as you connect them, they're going to want to connect through their own app. They're going to store patient information in their own cloud. So kind of getting, you can get ECG peripherals, you can get spirometry peripherals, you can get a wide variety of peripherals. They're going to work for one particular device type. So we have Android and we have iOS device types, and they typically work for one or the other, or there may be multiple that they'll connect with. They'll generally connect through an app. Getting those to work in a live telemedicine environment, it can often be challenging. So if you are using these sorts of peripherals, what you can do most of the time is you can collect this information in advance of the visit, and then if you want to do a live video visit encounter, you can as well. But that said, there are a variety of peripheral devices out there. We're seeing more and more devices that are coming out that are more all-in-one, and that the potential for use with the live video conferencing. But if they have that capability, most of the time they're wanting to do that live video conferencing through their particular application, kind of using their software. So the potential is there. Right now, by and large, what we're really seeing is most people are using mobile connectivity just for the video conferencing at this point. And they're using, they are using some peripherals, but they're using those more for remote patient monitoring type services.
Is there a list of some of these peripherals on your website?
So on our website, we do have a variety of different devices that we've looked at. We can't make recommendations because we are vendor neutral, and because the scope of the market is so broad, we would really prefer to actually talk to you about your particular use case. So what I would recommend is if you have a particular use case that you're wanting to support, and that kind of drives us back to the point that we had earlier, is whatever technology you get, it needs to support whatever care model you're trying to deliver. But we can absolutely work with an organization if they're looking to support a particular care model. We'd be happy to discuss that. We'd be happy to discuss some of the technology we've seen on the market that might help support that care model.
And just to kind of follow up a little bit on what Jordan is saying, you can imagine the explosion of the applications that are occurring, especially now. We're going to see a huge rise in direct-to-consumer medical peripheral equipment that are designed to be used on tablets and cell phones because of the stay-at-home orders and providing services to the patients in the home. So as soon as we get something published on our website, it's obsolete. So we will continue to update it. We're working on that right now, actually. But as give us a call about what your needs are, provide some information for you. If we don't know the answer to your question, we have in CTRC as well as our other colleagues.
Yeah. So if we don't have a answer for you, we want to know about your use case, and we can absolutely dive into your particular use case and talk to you about kind of what's available on the market. And if we don't have an answer, we can absolutely help research that for you. You broke up there a little bit, Doris, I think.
Yeah.
Yeah, sorry, I lost you, but I'm back.
Okay.
So any other questions? Okay, this was an excellent presentation. We will have this recorded and available. It will take us a little bit of time, but it will be available on texlatrc.org. And if you would like a copy of the presentation, they have generously agreed to provide that to us. So just send an email and we will get that to you. So next, any other questions or any other comments, Jordan or Doris? Okay, so to continue our summer webinar series, we will, next week's session will be about reimbursement, telehealth reimbursement policy, both CMS, in Louisiana and Texas, and we'll talk about the pre-COVID reimbursement policy and what has happened to that policy during the pandemic emergency. So continue to check our website. If you click on the summer webinar series banner, it will take you to each one of those sessions coming up. And then you'll be able to individually register for each of those. If we don't have anything else, we'll close for today. Thank you for joining us.